The next topic is very interesting. It's all about Philippines patients' Bill of Rights, the facts nurses and patients should know. This presentation is prepared to you by ExamWise. This is very interesting because we ourselves can become patients. However, we really don't know, or probably we know a little bit of our rights, or sometimes we think it's our rights, but actually it's not. The first one is the patient has the right to considerate and respectful care, irrespective of social economic status. Every person has a right to health and medical care corresponding to his state of health without any discrimination and within the limits of the resources, manpower, and competence available for health and medical care at the relevant time. The patient has the right to appropriate health and medical care of good quality. In the course of such care, his human dignity, convictions, integrity, individual needs, and culture shall be respected. Patients in emergency shall be extended immediate medical care and treatment without any deposit, pledge, mortgage, or any form of advance payment for treatment. The next right is the patient has a right to obtain from his physician complete, current information concerning his diagnosis, treatment, and prognosis in terms the patient can reasonably be expected to understand. When it is not medically advisable to give such information to the patient, the information should be made available to an appropriate person in his behalf. He has the right to know by name or in person the medical team responsible in coordinating his care. So in this case, the doctors need to inform the patients of what is happening to him, what kind of sickness or illness does the patient have, and what kind of treatment are they planning to give the patient, and what's the prognosis? Is the patient dying? Is it recoverable? Is it treatable? Or is it there for a lifetime? The patient needs to know. Sometimes we as patients, we don't know actually. We don't even know what kind of treatment they're giving us. We don't know that we are having antibiotics. Sometimes we don't know that we are given IV fluids. Sometimes we don't know what they think our sickness is. But when it comes to, say, the patient is not mentally competent enough, say the patient is confused or the patient is unconscious, the next of kin that the patient nominated or the significant others, not just the cousin or the relative, it should be someone that the patient has appointed as next of kin. This person should know what's going on and what's happening. The third right is the patient has a right to receive from his physician information necessary to give informed consent prior to the start of any procedure and or treatment. Except in emergencies such as information for informed consent should include but not necessarily limited to the specific procedure and or treatment, the medically significant risks involved, and the probable duration of incapacitation. When medically significant alternatives for care or treatment exist, or when the patient requests information concerning medical alternatives, the patient has a right to such information. The patient has also the right to know the name of the person responsible for the procedure and or treatment. Say, for example, your patient needs a blood transfusion. It's not only an informed consent, there should also be a written consent, but what is important is we have to let the patient know why the patient is having blood transfusion. What are other alternatives if the patient does not want a blood transfusion? And who will be giving the blood transfusion? Same as simple medication administration. So if you need to give antibiotics, you need to give an informed consent. Say, Hi, Mr. Smith, I am here to give you your antibiotics. Sometimes nurses just come into the room and just say, take your medication. Or they just come to the room, take your IV cannula, push something that you don't even know, like an antibiotics, which is not legally correct. Number 4, the patient has the right to refuse treatment or life-giving measures to the extent permitted by law and to be informed of the medical consequences of his action. There are patients who doesn't want resuscitation. There are patients who doesn't want blood transfusion even if their hemoglobin is very low. There are patients who doesn't want oxygenation. They have the right to refuse it. But the doctors and the nurses should inform the medical consequences of this action, but then it is permitted by law that they have the right to refuse such treatment. Number 5. The patient has a right to every consideration of his privacy concerning his own medical care program. Case discussion, consultation, examination, and treatment are confidential and should be conducted discreetly. Those not directly involved in his care must have the permission of the patient to be present. So say for example, during the nurse's rounds or consultations, there could be relatives or friends involved. In this case, we have to excuse and let them go out if they're not the next of kin. We don't know. The patient might not want the relatives and friends to know what's going on and what treatment is the patient having. Say, for example, you have a patient who is undergoing a liposuction. It's plastic surgery. But then the patient didn't want to know friends and relatives that she's done one. Maybe she's shy to let them know that she's having a plastic surgery, making herself sexy and thin. But then when you came in as a nurse, you just said you have to you have to wear your you have to wear your garment, your compression garment, because you need to make sure that your tummy is tight after your liposuction. And then there you go, the relatives are there and the friends are there and the patient didn't want them to know, which is legally and considerably illegal and unethical. Number 6. The patient has a right to expect that all communications and records pertaining to his care should be treated as confidential. So there is confidentiality here when it comes to medical records, patient's notes, patient's charts, every communication. Say, for example, somebody has called asking for the diagnosis of the patient, how the patient is going. Well, we as nurses only will let the patient's next of kin know, and all charts and all treatments and all information in the patient chart should be confidential and shouldn't be shared to anyone else. Number 7. The patient has a right that within its capacity, a hospital must make reasonable response to the request of patient for services. The hospital must provide evaluation, service, and/or referral as indicated by the urgency of care. When medically permissible, a patient may be transferred to another facility only after he has received complete information concerning the needs and alternatives to such transfer. The institution to which the patient is to be transferred must first have accepted the patient for transfer. So in this case, this is where the patient needs to be transferred. Say, for example, if the patient was admitted to a government hospital or a public hospital because of an emergency, say a gunshot wound, and the patient has the capacity to pay and they want to transfer to a private hospital. So in this case, the patient has a right to information that the patient's transfer, I mean, all information about the patient's transfer, which hospital is the patient transferring, who is the doctor looking after the patient, what treatment will the patient expect when she goes or he goes to the hospital. And at the same time, we have to make sure But the private hospital as well has accepted the care and has accepted the patient. This also applies to patients going to rehabilitation centers or nursing homes when the patient actually needs another type of care and not the hospital or acute care because the treatment of the hospital has been completed, and at this time if the patient needs a discharge because the patient couldn't cope up at home, the patient needs to go to a nursing home. In this case, the patient has a right to be discussed what is intended of him, where is the nursing home facility, why should the patient transfer to the nursing home facility, and at the same time, before the transfer, the nurses should hand over or do endorsement to the nursing home, and the nursing home should accept the care of the patient before the transfer. Number 8. The patient has a right to obtain information as to any relationship of the hospital to other healthcare and educational institutions insofar as his care is concerned. The patient has the right to obtain as to the existence of any professional relationship among individuals by name who are treating them. It is the patient's right that nurses should introduce themselves and tell them their position. Say, my name is Catherine and I am your nurse for today. However, there are other hospitals where it is a training hospital and there are educational institutions that are tied up with them. Say, the nursing students. So in this case, you can say, my name is Catherine, I am your nurse for today, and this is Katrina, and she is a student nurse. She is first year, second year, third year nursing student from University of St. Paul, and we will be looking after you today. Number 9. The patient has a right to be advised if the hospital proposes to engage in or perform human experimentation affecting his care or treatment. The patient has a right to refuse or participate in such research projects. There are times when hospitals are conducting research for quality improvement or research to develop quality of care. In this case, the patient needs to be informed about the research, but the patient has a right to join or refuse the research project. Number 10. The patient has a right to expect reasonable continuity of care. He has the right to know in advance what appointment times the physicians are available and where. The patient has a right to expect that the hospital will provide a mechanism whereby he is informed by his physician or a delegate of the physician of the patient's continuing healthcare requirements following discharge. There are times when nurses do not let the patient know or do not give instructions to the patients about discharge. This is unethical. When the patient needs to discharge, the nurses should arrange an appointment for the patient for a follow-up checkup. If in case the nurses could not arrange, at least the nurses can instruct the patient and the nursing discharge summary on when is the follow-up appointment of the patient. Number 11. The patient has a right to examine and receive an explanation of his bill regardless of source of payment. That is very self-explanatory. We need to know our bill, and if we need an explanation, why are we paying this for? We have the right to information. And number 12, the patient has the right to know what hospital rules and regulation apply to his conduct as a patient. So in this case, I know private hospital implies this policy by putting their rules and regulations on I think it's on the door or as a brochure and let the patient read them. However, in government hospital, this does not apply, but it is unethically correct